Hey guys, Damron here. Today I want to talk all about the menstrual cycle and exactly what's happening. A lot of women don't know what hormonal changes are happening and what symptoms they can be experiencing, what's normal, what's abnormal, and then what to do about it. So in today's video, we're going to uncover it all and really decode the mysterious menstrual cycle so that you all are a little bit more educated and know kind of what's going on. If you haven't hit the subscribe button yet, hit that button to be notified anytime I post new content related to women's health, hormones, or holistic health. Okay, so we know due to our 5th grade sex ed class, if you remember that far back, that the menstrual cycle is a complex interplay weave of hormones that occur roughly over about 28 days, although textbook says it can be still considered normal for a menstrual cycle if it's between about 21 and 35 days. Now, obviously, you do not want your cycle to be going all over the place. You should find a pretty consistent place for you where your body likes to stay within maybe like a day or two. So if your cycles are going from like 21 days to 35 days to 40 days to 20 days, that is considered an irregular cycle and something that we would want to look into deeper. Okay, so we know that the menstrual cycle obviously is important for reproduction. That's what most of us are taught that it's for, but there are actually other aspects of the menstrual cycle that are really important for women's health that we are not really discussing as often as we should. There are different parts of the cycle, right? So there is your period, there's ovulation, there's the premenstrual time. There's a lot going on during the cycle, and most of us, again, only pay attention to it really if we want to get pregnant or don't want to get pregnant, and we're doing more like the fertility awareness method or something like that. But like I said, these hormones that we have, like estrogen and progesterone specifically, that change and kind of go on this roller coaster throughout the month, are important for so many other things that are critical for our health and well-being than solely just having a period or getting pregnant or fertility. They really do amazing things, and we're going to uncover that here in this video. So in my opinion, by understanding the menstrual cycle, which a lot of women just maybe don't even care, but I think that by understanding it, we can start to make informed decisions, obviously about our fertility and about what that needs to look like, but also for, birth control, for other health concerns, for irregularities, for baselines. Like, we can uncover a lot about our actual physical health in a lot of different ways based on our menstrual cycle. I always like to tell my patients that it's kind of like the 5th vital sign. And by looking at it each month, we can use it as a monthly report card to kind of get a picture into what the state of our hormones are, and therefore other aspects of our health as well. Okay, so first off, I want to kind of talk about the 4 phases of the menstrual cycle. So the 4 phases of the menstrual cycle are: number 1, menstruation or your period. Number 2 is the follicular phase. 3 is ovulation, and 4 is the luteal phase. So each month and each cycle, we really go through these 4 different phases. In Chinese medicine, just as a quick little FYI, we diagnose these different phases and call them something different, but they are virtually the same from Chinese medicine and Western medicine and what's happening and what we're looking for. Okay, so the first phase obviously is menstruation, and that is when your uterus is shedding the lining in preparation for the next cycle. This is obviously when we're bleeding, and the normal level of blood that we get is about bleeding between about 3 days and 7 days. If you bleed over 80 milliliters of blood per cycle, that means that you are medically defined as a heavy period. So what that means is, think about a regular tampon or pad holding about 5 milliliters of blood, and a super pad or tampon completely saturated is holding about 10 milliliters of blood. So think about your own cycle, and if you're over 80 milliliters of blood, and again, you can get like cups and discs and things like that that measure this a little bit better, but on average, that is about what that looks like. So if you're bleeding over 80 milliliters of blood, there's probably something else that we need to discuss. Maybe that's too much estrogen, maybe that's pelvic inflammatory disease or fibroids or a myriad of other things. Some people also have something called von Willebrand syndrome, which is where your body has like issues clotting. So if you also have had a heavy period for your entire life and it's never really changed, it might be worth chatting with your doctor to see if you have something called von Willebrand disease. But in general, we'd want to kind of, look at that, be a little bit of a detective to figure out what's going on with those heavy periods if that is actually the case. Okay, so the follicular phase is that first phase after menstruation where your body is preparing to ovulate. So your body is choosing the follicles that it's going to rupture, and in general, most months, obviously, we have one follicle that goes to its dominant state so that if necessary or if wanted, your body could conceive that follicle. Ovulation occurs when the mature egg is then carried into your fallopian tube and is in preparation of getting fertilized. This usually happens about midway through the cycle, usually can take about 16 to 32 hours, and remember that it is possible to get pregnant anywhere from about 5 days before ovulation to a few days after ovulation, up to about 72 hours. So keep in mind that this process of potentially fertilizing this egg or getting pregnant could be like about a week of the month. Some people it's significantly less. Some people it can last that long. So just so that you know and can be prepared for that. Okay, so then after ovulation, ovulation is what's going to trigger your body to raise progesterone. Progesterone is also called progestation, and so that is going to help your lining thicken in preparation for pregnancy for that embryo. Your body also at this point produces small amounts of estrogen as well, so both estrogen and progesterone are in decently high amounts in this luteal phase, which for some women can cause all the PMS symptoms. So we want to look for things like breast tenderness, fatigue, spotting, headaches, bloating, cramping, acne, all of the good, PMS symptoms that we can occur can also kind of give us an insight into the state of these hormones and the state at which your body is metabolizing these hormones as well. So it's always good for practitioners like me for you to really keep tabs on kind of what you're experiencing and when, especially if you are spotting. If you're spotting and having kind of abnormal bleeding patterns, it's really important to make sure that you kind of know when those are and see if it occurs over a pattern over the next 2 to 3 months, because that can be really indicative of what's going on and what's happening inside, so that we can do a little bit more diagnostic with you, and I can, practitioners like myself can refer you to the correct practitioner. We can, do ultrasounds on the correct days, all of those things. So it's in your best interest to kind of be aware of what's going on with your menstrual cycle so that we can, obviously identify irregularities and things that may not be super common, as well as notify things that might be more common, such as a little bit of spotting at ovulation can happen due to that release of that egg. So there are some normal things that can happen that might feel a little weird, and then there are some abnormal things that we would definitely want to get to the bottom of. Okay, so here's a couple reasons that you would want to further investigate with a healthcare provider if your period does some different things. So number one, your patterns change. So obviously in perimenopause, which I have a video I'll link down below, that is really like the definition. Your period just starts to become shorter or longer or heavier or lighter. And so if your patterns change over the course of a couple months. Now, I always tell my patients that the endocrine system is really sensitive to things like stress or transitions or dietary changes or any of those things. So if there's some kind of weird thing that happens one time, it might be worth it. It may be worth it to chat with your doctor about it, but it might also be worth to just wait and see for another month to see if that exact same thing happens. And this is where it's important, like I mentioned, to kind of keep notes on this and keep details on when these things are happening, when you're noticing them, when spotting or different symptoms are occurring. You also might want to chat with your provider if your periods just keep getting heavier and heavier. That means that you need to change your pad more than about every 2 hours. That would be a sign of abnormally heavy bleeding, and like I said, could have a root cause of hormonal imbalances like too much estrogen or not enough progesterone, but also things like pelvic inflammatory disease, endometriosis, adenomyosis, fibroids, blood clotting things. There can be a lot of other issues that can cause that, thyroid conditions. So it might be worth to do a little detective work to figure out if your period all of a sudden has not been this way forever, what's going on there. If your periods last more than 8 days. So periods should be done bleeding fully within 8 days. If your period, used to be really short and now you're kind of noticing like different spotting and things like that, definitely worth it to go into your healthcare provider. You might have something like a cervical or uterine polyp that's getting irritated. So a lot of women have these. They're very common. They're usually benign. They are like little skin tags. And on the cervix, they can actually just be removed in office very easily. If it is more of a uterine one, it's a little bit more of a procedure, but definitely worth getting an ultrasound or just even a quick pelvic exam to make sure that nothing like that's happening. If you are just noticing that you are spotting more after your cycle, upon like exercise or exertion, upon intimacy, any of those things, definitely worth it to go chat with your doctor about it. Your periods come less than 21 days apart. This is the very fastest that your period should come at 21 days. If they are coming before that, definitely chat with your doctor. There's a good chance you have something called estrogen dominance or too much estrogen, not enough progesterone, that we need to really get your hormones balanced. And that's where practitioners like myself really shine. But definitely getting a little bit of blood testing, a pelvic exam can be really important for that too. If you start noticing that you're not having a period, so there's also things like PCOS, polycystic ovarian syndrome, hypothalamic amenorrhea, thyroid conditions, other pituitary gland issues, high prolactin levels that can really cause your periods all of a sudden to stop as well. So if you're, used to having a cycle pretty regularly and you're going like a couple months in between, that's also a sign that we need to get some lab work done to know kind of what's driving that. And then we can start to really work on healing that from a root cause. Because like I said, you guys, your hormones do so much more for us than just our menstrual cycle and fertility. They help with your brain health, your bone health, your heart health, metabolic health, digestive health. They do a bunch of other things. And so it's in our best interest as women who want to stay healthy to get exposure to these hormones in normal levels. And there are so many things we can do. I'm asked about this all the time, and I have so many resources on my podcast, The Damron Show, and right here on YouTube with different hormonal imbalances, if you know what's going on, and if you don't know what's going on, testing to do and lifestyle changes to do and herbs and supplements that can be helpful. There really is so much we can do to regulate this and get your body back in track. I always tell my patients that our body wants to be in balance. It's not its MO to be out of whack. There's certain drivers that are causing this, and it's up to us to figure out what they are and how to kind of correct that, which we're really good at now. You also want to, again, speak to your doctor if you're having abnormal bleeding, you bleed after sexual intercourse, or your periods are so severe that they're affecting your daily life. So cramping, headaches, migraines, acne, breast tenderness, bloating, constipation, severe panic attacks, anxiety, insomnia. There's a lot of symptoms that can become very severe with different period and hormonal imbalances that can affect women's daily life. And that is really my mission in this world, is to improve women's quality of life so that they're not having to dread their cycle every 1 to 2 weeks out of the month, because we need ourselves to show up more than that, and you deserve to show up better than that and feel better than that, so that you're not having to dread this. So that really and truly is my mission in life, is to help women regulate their cycle so we can have better moods, sleep, energy, and periods. So I hope this video was helpful for you guys. If any of this stuff's going on, always speak to your healthcare provider, and you can definitely find the bottom of it. If they're unwilling to, like your OBGYN, you can find other practitioners like myself who will do a deep dive with hormonal testing, asking you the right questions, figuring out lifestyle solutions, all of that, to really, on a root cause, more holistic approach, get to the bottom of what's going on. I hope you guys enjoyed this video. If you have not hit the subscribe button yet, hit that button to be notified anytime I post new content relating to women's health, hormones, and holistic health. I'll see you guys in the next one.